Hey there, my name's Kester. Just thought I'd do another video doing the progressions on the OI and POTS slash dysautonomia exercises. This is the third video. So if the exercises here are kind of beyond your capacity, go back and watch the second and try that first, or even the original video, which was probably about a couple of years now. Yeah, so I'm just going to take you through the exercises. I've got 5 exercises to go through. I'll just give you some kind of considerations as you go and explain and cue how to do the exercises. There's another video where I've just done a bunch of considerations to make when you're, or things that can kind of help your body tolerate exercise when you are dealing with chronic invisible illnesses. So go watch that if you want some more context around this, because it is really important that you're considering all those other factors, that you're pacing, you're listening to your body, where your spoons are at, hydration, safety, all that sort of stuff. But this is an exercise video today, so we'll get started. So last video we did a progression on the bridge, which was basically 2 up, 1 down, and you kind of just alternate between legs, 2 up, 1 down. So this next exercise is a pretty decent jump up. It's going to be the single leg bridge. So I suppose after a little while of doing the 2 up, 1 down, you might feel like you're kind of ready to progress and challenge yourself a bit more. Even if you're just doing, a handful of reps, 3 or 4 of this, and you feel like you can tolerate it and you want to challenge yourself, that's totally fine. I'll demonstrate. So essentially it's just a bridge, but you're doing it with 1 leg. There's a few ways you can do it. Like with the other leg that's not planted on the ground, you can have it just kind of vertical like that. You can kind of have it down, more closer to being horizontal, which might be a little bit harder, especially for your abdominal muscles, which could be an added benefit depending how you look at it. But straight up is a little bit easier potentially. Basically, we're just pushing up, driving through our heel, just like we did with a normal bridge, but we're going to be on 1 leg. And obviously that's a lot more difficult because, 1 leg's taking the entire load. Just demonstrate on both legs. Between each set, you'd want to have, a good minute, I'd say. And that can be longer as well if you're, really wanting to take it easy and wait for your heart rate to come down. And you want to pace it that way. That's totally fine. You don't necessarily need to do exercise or sets in quick succession to get benefits. So last session we were doing this one. So it's a very similar version. Hands by our side. Try and kind of switch your abs on. And we do like a posterior tilt. So just try and flatten your lower back, and that'll help switch on your abdominal muscles. Hands by your side. And we're still alternating. But the difference is here that we're going to bring our leg entirely straight. There goes my knees. Yep. Just like that. If you want to hold at the bottom for a second, that's even better. But yeah, a little bit more difficult than the last one because we're bringing our legs completely straight. Okay, next exercise. Let's go to grab my TheraBand. So yeah, you'll need one of these. I think Brooke's done a video doing this exercise, but I thought I'd double up because it's a good one. It can be a band, like a sheet like this. It can be a tube, whatever. Basically, we're just finding a level. We want to be, arms kind of straight in front of us. Once you get out here, not that this is, pointless, but we don't get quite the level of stretch and range of motion if our arms start a little bit closer and there's resistance start beginning from here as opposed to out here. We're going to do it on our back. You can do it sitting up, but supine obviously posturally is going to be more comfortable for people with POTS and less of a postural challenge. Good exercise here. We know that coat hanger pains are a really difficult thing with people with dysautonomia because that blood flow is not getting up. And by doing this exercise, we're kind of encouraging blood to that area. We're using those rear delts. It's mostly going to be rear delts and rotator cuff, but there might be a little bit of, traps and rhomboid activation here as well. So just like I did it, standing up, but lying down, arms starting, right above your shoulders, keeping your arms straight-ish. You don't have to be locked out. You don't want to be all the way locked out, but we're not flexing and extending our elbows throughout this movement. The wall's in the way. So just like that. So just bring our arms straight down to the floor. Like that. Try not to shrug when you're doing this one. Try not to shrug up as you're coming down. You're just pulling straight down like that. All right, next one. So these next two are pretty, like maybe a bigger jump progression, just because you're more upright. You're not supine for this next exercise. Obviously, like supine on our back is going to be generally the best tolerated, depending on how difficult it is. But we're going to have one seated and we're going to have one standing. So there's going to be an added postural challenge there. But obviously at some stage, if you're trying to progress and kind of condition your body to be able to tolerate, more walking and standing, then these, as long as it's within your kind of tolerance, you want to monitor how you respond to it and see how you go afterwards, and make a solid estimation of whether you think that's within your kind of baseline, just knowing what you generally have been able to tolerate. But over time, building these in really, really slowly can actually build up your standing and walking tolerance. And these are things that we do every day. Like I'm going to do a sit to stand, and obviously getting out of chairs is something that is obviously really functional for day-to-day life. All right, so sit to stand. As the name suggests, starting in a seated position. Have a look at your feet. Make sure that they're kind of like a mirror image of each other. So they're kind of set up next to each other. One's not kind of out to the left and toes are pointed outwards. So just kind of at an equal level, reasonably close to the chair. You don't want your feet too far out because that's going to be a different exercise. Feet close to the chair. So I guess the first version of this would be like you'd have a chair with arms, and you kind of use that to assist if you needed to, which is totally fine if that's where you need to start from. Next one would be like hands on knees, and then you go hands on chests and on chest, or then maybe hands like out the front. That would probably be the hardest one. Thinking about keeping your chest up. If you can avoid that like hunch forward and momentum to get up, even better. But if you need to do that to begin with, that's totally fine. Like I said, just start with a handful of reps, whatever you can tolerate. If you wanted to progress that one even more, really control the eccentric. So kind of slowly lower yourself down rather than just kind of letting gravity take you down. Next exercise, calf raise. We did this seated in the last video. Today we're going to do it standing. So nothing really changes except for the fact that you're standing. Make sure you're near a wall, something to grab onto, just for balance. This isn't a balance exercise. We're trying to train our muscles to get stronger. So we want to have our, arm touching something. So yeah, balance isn't a factor. Driving up through our big toe. You can hold at the top for a second if you like, and then coming back down. I'll do one from the back. Cool. So yeah, some things you can try. Thanks for watching.